We're going to discuss what is dyspraxia. In working with the Learning Disabilities Association of Newfoundland and Labrador, as well as the Learning Disabilities Association of Ontario, this is the information that we would give parents of whose children have diagnosed dyspraxia. So to put dyspraxia down in a compressed form, it refers to a specific disorder in the area of motor skill development. Youth and adults with dyspraxia have difficulty planning and completing, performing and sequencing intended fine motor tasks. Something you may not know is that it's estimated that as many as 6% of all children show some signs of dyspraxia. And within the general population, about 70% of those affected with dyspraxia are actually male. Dyspraxia can affect different areas of functioning, varying from simple motor tasks, such as waving goodbye, to more complex tasks like brushing your teeth. What are the effects of dyspraxia? Dyspraxia is a lifelong disorder that affects a person's development in the area of motor development. Though many challenges can persist throughout a person's life, the types of difficulties experienced can change. So there is hope. I'm going to break down these effects for you in 3 categories. The first category being with young children, the second category with school-aged children, and the third category being with teenagers and adults. So let's start with the young children. This category involves infants right up to school-aged children. So in this category of young children, babies with dyspraxia may avoid crawling and rolling over, and they may resist tasks involving motor skills, even to the degree of natural development when an infant is then starting to reach out and grasp a hold of your finger, of objects. And as they get older, these children are prone to, and again before school age, and even continuing into school age, they may have difficulty with eye movements. And with this difficulty, they may move their whole head instead of just moving their eyes. They may have difficulty using eating utensils, a fork, spoon, and even holding a cup while drinking. They may have difficulty walking, even the coordination of walking, of hopping around and skipping, throwing and catching a ball, and yes, even riding a bike. There's also a delay in using spoken language and speech that is difficult to understand. So what do we mean by this? We have certain words that have 3, 4, 5 syllables, like hydrogen, spaghetti, coordination, and even words like that may be simple for others to say. Young children with dyspraxia may avoid those words until they feel more comfortable or even spend time practicing at home saying these words. And with some young children with dyspraxia, they may be well into their years before they feel comfortable with these words. One of the key effects of young children with dyspraxia is that they bump into objects. So it's almost that the brain has some spatial deficits where they are nearer to an object before the brain registers that they are upon that object. Another one as well is the late in years establishment between the left hand and the right hand. And if that's the case, a strategy may be to point out maybe a birthmark or a mole or maybe they had a little accident on one of their arms, and then to use that source as the focal point to say, okay, you had an accident on this arm, you can see where you had a few stitches, what have you, or a scar. That is your left arm, which is so important to relate, because especially when they get into school age and the teacher is saying, okay, I want you to use your left hand or raise your left hand, or you're in sports and I want you to go left, they then can immediately say, okay, I had an accident with this arm, or I have a birthmark on this arm, and immediately the brain can register, okay, my left arm is here. Okay, great. Instead of having to stop and take some time and think about it. Another effect of young children with dyspraxia is difficulty doing fine motor activities, such as tying their shoelaces, buttoning their clothing, using scissors to cut, drawing, coloring, yes, coloring within the lines, printing, writing. Another effect that's not well known is the sensitivity to touch. They may find certain fabrics within their clothing uncomfortable. They may find hair brushing, someone brushing their hair or brushing their own hair, very uncomfortable. Even cutting, getting their own hair cut, they may be sensitive to that as well. Sensitivity to teeth brushing and even getting their nails cut may also be unpleasant. And another key effect is the poor sense of direction. Being able to take directions and being able to follow through in directions. And that may overlap as well into auditory processing disorder. So on to our next category, which is school-aged children. Within the category of school-aged children, dyspraxia can make it difficult for children to develop social skills, and they may also have a hard time, trouble getting along with peers, with others within their same age group. Though they are very intelligent, these children may fall behind in terms of catching up with their social skills and social interactions. And some children may be prone to develop phobias and obsessive behavior. So a dual diagnosis may be OCD, obsessive compulsive disorder. All young people, all young children that are within the school age must deal with their rapidly changing bodies. However, many young people with dyspraxia may also have the added stress of dealing with coordination problems, as well as speech and academic difficulties. And if you've ever had coordination difficulties, you know that when it comes to gym class, physical education classes, and other sport activities, it can be particularly problematic. Those with dyspraxia within the school age may have speech difficulties, and these speech difficulties can interfere with casual conversation, which therefore then can result in social awkwardness. They then may pull back and be unwilling to take risk in engaging in conversation, especially when it comes to anyone new within their group. They may just stick with having conversations with individuals that have known them for years. Within the school age, these young children with dyspraxia, writing difficulties such as poor letter formation, their pencil grip, and slow writing can make school work frustrating. They may also have a dual diagnosis when it comes to dysgraphia, also with dyslexia. Now moving on to our next category, which is dyspraxia in teenagers and adults. With the effects of dyspraxia on teenagers and adults, it can be seen in all aspects of their everyday life. These difficulties, deficits, can have an impact even when it comes to them driving a vehicle. Remember, I had talked about spatial relation So there are some spatial deficits when it comes to in behind the wheel of a car, and the spatial deficits between other vehicles, making a left-hand turn, making right-hand turns and keeping within the lane closest to them. Parking. Parking can be a nightmare if you have spatial deficits. Then we have dyspraxia in the effects of even completing household chores. We know there is a lot of movement involved and fine motor skills. Then we have cooking. Then we know with cooking, you're using a lot when it comes to your hands and your arms and moving from the counter to the stove to the oven, taking pans out of the oven, making sure you don't burn yourself, moving the pots to the dampers, pouring cups of water, flour in a bowl. So there can be some difficulties there as well with cooking. Then we also have challenges when it comes to personal grooming and self-help activities. Even your own exercise regimen can be a challenge. And the manual dexterity needed for writing and typing also follows you into teenagehood and adulthood. Speech control. So what challenges are with speech control? It involves a volume, having control over your vocal folds, your vocal cords, your pitch, and your articulation. So asking a question. So an example when asking a question. When you ask a question, do you normally go up at the end of the sentence when you ask a question? So articulation, right? When you're stating a point, your articulation is that you go down at the end of a sentence when you're making a statement. Example, my passion has been with youth leadership from the time that I was 14. Then we also have challenges when it comes to perception. So there are some perception inconsistencies, and these perceptions have to deal with relations to over something and under something and in something and in between something and around something and on the side of something, and sensitivity to light, different lights and fluorescent lights and lights coming from the laptop and desktop and going out, and if you're in a place where there's a lot of snow, right, you almost get snow blindness. Sensitivity to touch, sensitivity to spatial relationships, sensitivity to taste, and sensitivity to smell. It is important to note that a person displaying the kind of difficulties that I have expressed to you, that it does not necessarily mean that they have dyspraxia. But if a person continues to display these types of difficulties over a period of time, then yes, testing for dyspraxia by trained professionals should most certainly be considered. Okay, let's continue on. Dyspraxia and other developmental difficulties. Though not always, dyspraxia often coexists with other learning disabilities, as I had already pointed out with a few examples. So other learning disabilities such as dyslexia. These are individuals that have difficulty reading, writing, and spelling. Other learning disabilities such as dyscalculia, which is difficulty with mathematics and formulas, as well as AD and ADHD, attention deficit, hyperactivity disorder. The symptoms from these learning difficulties can be similar to those of a person with dyspraxia. And regardless of whether there is an overlap in disabilities, the severity and the range of the difficulties and deficits can vary widely. So it can go from mild to severe, and it doesn't matter if you have a dual diagnosis or undiagnosis with other learning deficits. Other common difficulties facing people with dyspraxia unfortunately include low self-esteem, depression, mental health issues, and emotional and behavioral difficulties. They may have weaknesses in comprehension, information processing, and listening. All of these can contribute to the difficulties experienced by people with dyspraxia. So in ending off this little information session here, what strategies can help someone with dyspraxia? With the strategies that can help a person with dyspraxia, while there has not been any cure found to totally overcome dyspraxia, there are, however, early interventions that can help a person learn to deal with his or her difficulties, deficits. So there are some interventions that can help them cope and move through their daily lives. Depending on the severity of the disability, these individuals can work with an occupational, speech, and physical therapist. These therapists can greatly improve a person's ability to function and succeed independently. Beginning at an early age, it is vital that caregivers, parents, offer their child patience and encouragement. It can be very frustrating to have difficulty communicating and moving around, and a caregiver can help ease that frustration by offering help and support in overcoming these deficits. So it is important that we encourage the individual to want to succeed instead of resorting and retreating inward. All people with dyspraxia need help practicing simple tasks, example like buttoning up a shirt, and they can benefit from step-by-step progress into more complex activities like baking some muffins, cooking a meal. It's important that we encourage the physical activities that develop coordination, and this then can increase confidence. It's also important to encourage friendships to broaden a person's experience and understanding of social relationships. So if a young individual with deficits is encouraged and put into situations where they're making new friends, where change is happening in their life on a constant basis, it will allow for this young person to want to move ahead when they get into adult life. And anything that we can do to encourage an individual to want to succeed, to put as much confidence and self-esteem into their lives, can help them move and transform into becoming a leader, a teacher, a role model, someone to look up to. Each and every day, these individuals have so much taken away from them. And it's unfortunate that society and even their own peers, and yes, even caregivers, can take away the self-confidence and the self-esteem within them. So it is important that if you're in a situation to build that individual up, that you just pour so much support and care and love into that individual. Because as they have a hard time maneuvering through life with so much challenges and deficits, it's up to us to give them a head start. It's up to us to help them become excited for life and excited in learning, and to become so confident in themselves that when one of their peers tries to put them down, that they have so much pride in themselves, so much confidence, so much self-esteem, that they will not allow one person to ruin their whole day, that they would be the one that others will go to and ask for help and ask to be taught by them, and that they too, in being demonstrated encouragement, will be encouragement onto others. We are here to make a difference, and we are here to encourage others to make a difference. Because as we know, there is so much negativity, challenges in this world that we need to lift each other up. Agree? It has been a blessing relaying this information to you. I would love for you to reach out to me. I'll include some contact information, and as well, get the conversation going. Leave a comment. If someone has left a comment and is struggling, encourage that person. This is a platform for us to be here for one another, to offer help, and to be a light for the world. Blessings, everyone.